Fragile X is the #1 cause of inherited intellectual disability. A mutation in the FMR1 gene causes both premutation and full mutation extensions. The latter stops the production of FMRP, which means the brain does not develop as it should. Sensory, behavioural and/or developmental challenges may be seen, and autism is often associated or diagnosed alongside Fragile X. People with Fragile X are often described as caring and loving, but most of all, a great sense of humour. Fragile X is described as rare. This is due to low awareness and therefore rarely diagnosed, rather than it being a rare condition. We are working to put Fragile X on the map in the UK, starting here in the East Midlands.
We know that Fragile X is an X-linked disorder. That means it tends to be carried by ladies who tend to be a bit less affected, but it can affect girls. But they can have affected sons.
This is our family. I feel like we don't want to be chasing diagnoses so that we can get support and help. There should be an overall look at this is what a Fragile X child needs, and these are the areas that they will need help in, rather than us having to break it all down and try and push for support in areas where they feel like actually it's not our place to be helping.
Often when the early diagnosis is made, the first thing that a family member will want to do is phone somebody up, try and find out more about the condition. Clinicians only have a very limited amount of time to explain, so they will come to us. They will want to know, what does this actually mean? What is going to happen to my child? What's the journey that we are on? How is it going to affect the rest of our family?
We've been involved in our understanding clinical aspects of Fragile X, the needs of patients and families, and gaps in care to try to improve basic care with medications that we currently have, as well as other supportive care, and also the impact of the variation in FMR1 mutation and modifier genes and environmental factors on the clinical manifestations in Fragile X. And then we've been doing a lot of translational research to try to develop new treatments targeted to the underlying mechanism of disease in Fragile X, and that has involved trying to have better outcome measures for trials, biomarkers for target engagement for trials, and clinical trials of new agents aimed at modifying the course of Fragile X.
You know, we have medicines that we know can be effective for things like anxiety, for inattention, for hyperactivity. We have other interventions like speech and language and occupational therapy which are helpful to people. But we need to know how they work for people with Fragile X syndrome, who's going to benefit most from them, and how we get them to people in an appropriate fashion in the future.
Now, we're taught as doctors that you give a drug to your patient when you feel that the benefit from that drug is going to exceed the potential risk or side effects that may occur. Well, kids with Fragile X are the same as the rest of the population. Sometimes they need medication, sometimes they don't. That decision, though, as to whether it's appropriate should be based on a careful clinical assessment followed by a plan with the individual and or their parents to trial the medication if, again, it's felt to be beneficial. I think, though, to not give medicine to somebody that needs it can potentially do great harm.
It's an incredibly exciting time for us. We have the Reconnect study about to open. We've got plans to hopefully move on and open other studies in Fragile X.
So we're really lucky in Leicester to have a dedicated children's research facility, and that's based at the Leicester Royal Infirmary, and it's called Research Space. So it has a waiting room, it has 3 clinical rooms, and we have Lots of lovely interactive facilities to try and make the experience as really positive as possible for the patients, the children, the young people and their families when they come in.
It's a fun space to work in. It is serious, but it is enjoyable. There are real benefits to working in research, working in clinical research, getting to know families in a way that you don't really get to do in clinical practice, getting to engage with people from around the country, from around the world, getting to engage with voluntary organisations. All of these things are actually really rewarding on a personal level.
We're looking for good people to do good things and help the community.